What's up, everyone? This is Drew. I'm with Incredible Marketing. We're here back at the IM3 booth at ASAPS 2017, and I am joined by Julene Samuels. Welcome.
Thank you.
Thanks for joining us.
Thank you.
So talk to us about ASAP so far. I understand you've had a couple presentations.
I have. I come to this meeting every year. Usually I'm in solo private practice, but I do only cosmetic surgery of the face, breast, and body. So today I was presenting on Core Intima, which is the new laser vaginal rejuvenation device made by Syneron-Candela.
Okay, awesome. You want to give some more details about the presentation?
Sure.
Or maybe even about Syneron-Candela and the device that you're using for that?
Right. So I did a study last year. It was the first clinical trial with plastic surgeons and urogynecologists on the use of their fractional CO2 laser specifically for vaginal rejuvenation and primarily to treat symptoms of vulvovaginal atrophy, genital urinary syndrome of menopause.
Okay. Right on. Awesome. So the presentation went well, though?
It did. It's an area of medicine and in plastic surgery especially that is just sort of exploding.
Yeah, absolutely.
In interest.
Yeah.
Driven primarily by the patients who a lot of this time have not been aware that they had options like this to help them with some very common symptoms that over 75% of women with menopause experience. And, I think even not just patient awareness is the issue, but also, they've been meeting with their own physicians during their wellness visits and not being asked,
Sure.
how big of a deal is this as
Sure.
you age. So I'm very gratified that we get some presentation and speaker time to make our colleagues aware that the lasers we use in clinical practice already for
Right.
our facial cosmetic surgery and non-surgical treatments, that we now can use those same devices as an extension into the area of intimate female wellness.
Interesting. So tell me more about that. So Syneron-Candela, that's the device, and it's just kind of like a module you can add on to that helps you do the vaginal?
This was a fractional CO2 device that already existed in the marketplace for facial aesthetics, for laser facial rejuvenation.
Gotcha.
And so it's sort of a best-in-class device in terms of being able to deliver energy with less downtime and less recovery issues for the patient than predecessor devices. And so this is an extension of that platform to use some of those same principles of how laser energy works on facial skin to benefit the female internal and external treatment options. And it's partly functional. The internal portion of the procedure is certainly functional to treat dryness and dysuria, dyspareunia. But externally, women have cared a long time about the aging appearance of their private area.
Yeah.
So it's a very natural extension for me.
Yeah.
I do the surgical labiaplasty procedures, and this is the non-surgical element that contributes to the things that surgery can't fix.
Gotcha.
In terms of the patient complaints.
Tell me more about your practice. Are you specifically focused on more of the female private part vaginal rejuvenation,
Yes.
or is it?
So I've been in private practice since, I've been in practice 22 years this year.
Okay.
And after about 3 or 4 years, limited my practice to just cosmetic surgery of the face, breast, and body.
Okay.
So, we take care of probably 85% women in my specialty, but the men are fast and furiously following.
Right.
So it's a very female-oriented specialty, though, nonetheless, and
Okay.
I've always enjoyed being able to be a female in the specialty.
Awesome.
So.
Talk a little bit about how, you mentioned how, these devices and technology have advanced so quickly, and now being able to do vaginal rejuvenation. I feel like I've only been in this industry for about 4 years. When I got started in this industry, vaginal rejuvenation wasn't really even a thing,
Right.
Where do you see that going in the next 5 years or 10 years?
Well, it wasn't a thing, mostly because I feel like women didn't feel comfortable enough to talk about it.
Okay, that makes sense.
Even with their own doctors.
Sure.
And there weren't a lot of options. You can take hormone therapy, and this is a part of the aging process, but the truth of the matter is that not all women want to take hormones. Not all women can take hormones. The compliance with hormonal therapy is questionable sometimes. So we've not really ever had any way to answer those questions. If they even came up in a normal wellness exam,
Sure.
It's like, well, I can put you on hormone replacement therapy.
Right.
So now that women know that there's something that's non-surgical, no pain, no anesthesia, no recovery time, they're the ones demanding this, and that's what is making the industry leaders and engineers come up with answers to these really common complaints.
Right. Now the demand's there. Now it's the supply needs to catch up.
Right.
Awesome. That's exciting stuff.
Yeah, so there are a lot of devices on the market now, but they all kind of have a little different mechanism of action in the way that they work. And it's certainly a multi-specialty type of interest that has been generated, plastic surgeons, derms, GYNs. But it remains, it's a laser, so our thoughts, and certainly I think those would be reflected by ASAPs, is that you need to be a laser expert, have some knowledge of the female anatomy. If you're a surgeon also, that's even better. And just educate your patients that these are out there, but it's important for them to do their homework in finding the right provider.
Great. Awesome. Let's segue a little bit. I want to ask you some personal fun questions about yourself. Right. Just random stuff. What's your favorite color?
Red, actually.
Red?
But I'll tell you, that's not like a good answer to my family. I live in Louisville, Kentucky, where the Cardinals are, but I'm from UK. I did med school at UK,
blue.
So I'm really blue at heart, but I tend to gravitate to red.
Okay. Nothing wrong with that.
Yeah.
Why'd you become a plastic surgeon?
Well, that's a good question. I actually, from medical school, targeted UT Southwestern because I thought I was going to be a trauma and a critical care doctor.
Okay.
So I did 5 years of general surgery training there, and it was in my 4th year of general surgery, it's a 5-year residency, that I did a rotation on the plastic surgery, in the plastic surgery department, and I loved the attention to detail. I loved the control we have over outcomes and the fact that it is a female-oriented specialty. And I tend to be a little bit of a perfectionist, so if I can control the outcome, that makes me happy. So I did a lot of micro and reconstruction and trauma while at UT Southwestern in plastic surgery, but it was the aesthetic part of it that really drew me in.
Sure. Cool. You mentioned something about how plastic surgery is really predominantly female-oriented, which it is. And I just had a thought how, I know things are changing now where there's a lot more female plastic surgeons. Do you have anything to say about how this industry has been dominated by men for the most part? Because I think it's ironic now that you mentioned that. It makes total sense that it is a typically female procedures with men.
Well, the reason I think there are relatively few of us, and I was the 11th woman through the program.
No kidding.
It's a relatively young specialty, actually. This is our 50th year for just the Aesthetic Society.
Right, yeah.
So it's the length of the training. Traditional training requires that you graduate from high school, go to med school. You have to have an undergrad degree to go to med school. And then I did 5 years of general surgery and then 2 years of the plastic and reconstructive surgery residency. And so I was 34 when I finished training.
Oh, wow.
And I just think that's a big chunk of time for a woman to want to give up in terms of training. And it's a pretty rigorous road to hoe. So I didn't want to have children while I was in training. And I think that's why it's been dominated by men. But I think the women are breaking through, and we're, doing some of the science and the research and the presenting. I trained at a great facility, which gives us credibility. But to our female patients, it kind of reminds me of that movie that Helen Hunt and Mel Gibson were in, which is What Do Women Want?
Oh, great one. Is that the one where he can hear what women think?
For a short time.
Yeah.
Then he goes back to
then
his
he gets struck by
male
lightning.
ways.
Yeah.
But that's why it's such a natural fit for us, because I can finish my patients' sentences practically. I mean, I go ahead and ask them, what do you want?
Absolutely.
And this is what we can discuss, but I kind of already know.
Right.
And I think they feel very comfortable confiding in us things that they may or may not confide to their male plastic surgeons.
Sure.
And many times the male plastic surgeons, with respect to their patients, will bow out at some point in the consultation and go get their female nurses to help them allow the patient to really open up. Sometimes they even mention that in meeting formats. But for us, it's just a little bit more of a natural, and I think that women have received female plastic surgeons very nicely, female GYNs, female derms. So it's just good to have that representation.
Awesome. Well, thanks for joining us. I really
Yeah.
appreciate it.
Thank you.
Have a good show.
Thank
We'll
you.
see you.